Good evening, everyone, and welcome to Wellness Matters, brought to you by the American Hospital in Dubai. We strive to give you a comprehensive look at a number of wellness and health-related issues every week, and welcome your questions in the live chat on Facebook, YouTube, and Instagram, so don't be shy. Every question matters. Your heart is probably the second most important organ in your body after the brain, beating an average of 100,000 times per day. That translates to 2.5 billion heartbeats over an average lifespan. So, how can you best take care of it? What are the warning signs and risk factors of heart disease, and what should you do in case of an emergency? We are going to explain it all tonight with Dr. Mohamed Salem, who is a consultant cardiologist at the American Hospital in Dubai and the Director of Interventional Cardiology and Endovascular Medicine at the Heart and Vascular Center here at the American Hospital. Dr. Mohamed Salem, thank you so much for being with us tonight.
Thank you, Maya. Glad to be here.
As usual, before we go into the details, let's tell the viewers a little bit more about you. So you joined the American Hospital in 2013. Before you practiced medicine for about 10 years in Pennsylvania in the US at the Guthrie Clinic and St. Luke's University Hospital and Network. You are an American board certified in cardiology, interventional cardiology, and endovascular medicine. And you have a master's degree as well in healthcare systems engineering. You are also a fellow of the American College of Cardiology and a member of the Society of Vascular Medicine. Thank you so much again for being with us, and I look forward to tonight's episode.
Thank you. I'm happy to be here.
As usual, let's start with the 10 quick questions, and we are going to try to debunk a lot of the myths surrounding heart disease tonight. So what are the most common heart problems you treat?
I would say coronary artery disease and heart failure.
What are the main symptoms that patients come to you with?
Chest pain, shortness of breath, and palpitations.
At what age do you think someone should start screening for cholesterol?
Anytime they can, I would say, but let's say 45 for men and maybe 55 for women.
Now, at what age should men start undergoing the full battery of tests related to heart disease?
I'd say the same, around the same age. That would be 45 and for men and 55 for women.
Now, myth or fact, if you have diabetes, you are twice as likely to get heart disease compared to someone who doesn't have diabetes.
That's an absolute fact.
Myth or fact, if you are fit, you don't have to worry about heart disease.
Total myth.
Myth or fact again, so chest pain indicates an impending heart attack.
That's possible.
What about if the heart attack, if you do have a heart attack, should you avoid exercise completely? You should avoid it, myth or fact?
That's a myth.
And dizziness is one of the lesser known symptoms of heart disease. Is this a myth or a fact?
That's a fact.
Okay. So we are going to go into the details in tonight's interview. But before we begin, let's start by explaining the different types of heart disease. So what are the most common types?
Well, if we look at the heart as an organ, is comprised of, we can maybe use that model, is from heart muscle, which basically has chambers and valves that they transfer the blood from one chamber to the other, and blood vessels that supply that heart muscle. So if we look at this model here briefly, we can see these, red things are the arteries, and that these are the coronary arteries. As small as they are the most important in supplying the nutrients and oxygen to the heart muscle. And the blue ones are the veins, like anything. And if we take that apart, we can look here. So that's a heart muscle. So this heart muscle can get weak at sometimes and can get disease, and these are the ones that get hurt with heart attacks. And inside are the valves that transfer the blood from one chamber to the other. So these valves can get affected by being leaky or tight and obstructing the flow of blood.
Now, what are the factors that put someone at an increased risk of heart disease?
Well, there are many factors involved. We can start by age. The older we get, definitely we are more at risk for heart disease. And then the high blood pressure. The high blood pressure is, we say about 120/80 is the normal blood pressure. So As we get older, also the arteries get stiffer, and that can increase our risk for heart disease. Diabetes is definitely a major risk factor, and the increased cholesterol. And finally, the genetic factors or family history of heart disease.
Now, heredity obviously plays a role in heart disease, as you just mentioned. But to what extent is it a major factor in you getting heart disease if there is family history, first of all? And second of all, how can you reduce those risks?
Okay, so that's a very nice question, because people think that if they have that family history of heart disease that they are doomed and there's nothing they can do. And this is a total myth, like we said. Actually, although the family history of heart disease is a major risk factor and it should be seriously considered, however, it's one of many other risk factors. And although we have some well-defined disease or genes that are being transmitted down the family tree, there are many that have not been identified. Like if we talk about the cholesterol, for example, we have a separate entity called Familial Hypercholesterolemia, where there is a specific gene that gets transmitted from one generation to the other. For the heart muscle, there is a dilated cardiomyopathy or general dilatation or enlargement of the heart with weakness of the heart muscle that also can be transferred through in generations. And also something that would affect the electrical activity of the heart, generating arrhythmias. So, but these are actually not the very common ones. The common ones that actually run in families, we do not know exactly. We were not able to identify which genes are there. So if you have a family history of heart disease, that's something to be considered seriously. Nevertheless, if there are many risk factors that enrich that kind of risk and make it happen. So if we take care of these risk factors, I think you can decrease the chance significantly for acquiring this heart disease down the line. So it is modifiable, and it is not a doomed fate.
Good to know. You mentioned that men should probably start checkups in their 40s and women a little later after maybe menopause. So what are the tests involved?
Well, if we start by knowing yourself. Like there are certain numbers that needs to be well known: the blood pressure, the blood glucose, and the cholesterol. So these numbers are very important to be known. And then we start over by simple putting that heart to test, which is what we call a stress test. Basically, the heart, the stress on the heart is to increase its demand by increasing the heart rate. So we put the heart to stress by allowing the men or women to start exercising in a graded manner to increase their heart rate up to a certain limit, and then we can see what the response of the heart to that added stress, and then we can determine if they are at risk to a greater deal. I mean, there are many levels of cardiac testing, but I think this as a base or introduction, I think it's very informative.
Some people might maybe avoid going to the doctor because they might be afraid, for example, of fainting during a stress test. How common is that?
That's actually very, very, very uncommon. I would say, in my 17 years of experience, I've never seen anyone collapse in a stress test. It's done in a very safe manner. The patient is usually attached to monitors, and the doctors we are actually physically next to them, and we're monitoring their heart rate, their blood pressure every few minutes, and it's a very controlled environment. And there is, if the patient has severe underlying disease and actually put that heart to stress, it might trigger symptoms, but usually the doctor who orders the test, have a pretty good idea about what is the risk of doing that. So if we think that a patient is not ready to put him through that kind of exercise, we're going to pick a different test than the regular treadmill stress test.
You mentioned that we should know our numbers.
Yeah.
Let's start with cholesterol and triglycerides, which are a risk factor for heart disease, having high lipid levels.
Correct.
What is a good cholesterol level to have? Let's explain HDL, LDL cholesterol, and how they work with the heart, how they fit into heart disease, and triglycerides. So what is a high level And what is dangerously high?
Okay. So in general terms, the level which we call, if we look at the population as in a general distribution curve, so we say the normal of a total cholesterol should be less than 200 milligrams per deciliter. And the LDL, which is a bad cholesterol, should be less than 130. But that's kind of a benchmark. However, we have to be careful because in certain risk group or risky group, then these numbers needs to be adjusted or modified. In other words, if someone who has diabetes, for example, then we need their LDL to be less than 100. If someone already had a heart attack or any evidence of any other vascular disease, then we need this level to be less than 70. So for them, 80 or 90 would be high. So, but in general terms, I think 200 and 130 are the numbers that.
So anything above 200 for cholesterol would require intervention?
Would require intervention, that's true.
Okay, and that would be medication or exercise and diet to start?
Well, okay. So if we look at the cholesterol, the majority of the cholesterol, or most of the cholesterol, is actually manufactured by the body. It's opposite to what people think, that it is mainly coming from the diet. The diet actually produce about 10 to 15% of your total cholesterol, but our body generate the cholesterol because we use it for other things, to build hormones and other bodily functions, and then we get rid of this or recycle that cholesterol that is being generated. And along this journey, this is when the cholesterol kind of hangs in the blood for too long and start to cause problems. So if we were to say that we start over by a diet, which is an important way to decrease the cholesterol, however, depends on our target, then this might not be enough. And then with the medication then gets introduced, and the medications are very effective, and sometimes we need to move even lower, and then there are now some injections that are available. That we use them for extreme cases to kind of help reduce that cholesterol even lower. So we have a long list of things that we can do to lower the cholesterol, but in general we have very, very effective means of lowering the cholesterol to where we want to be.
What is considered dangerously high for cholesterol?
Okay, so the total cholesterol is not, we look more at the bad cholesterol, the LDL, what we call low density lipoproteins, which is the small particles that embed itself under the lining of the vessel and start forming the plaque. And so what we'd say is the LDL is greater than 190. If that's the case, then that's a dangerously high level, and that needs to be treated regardless of your risk profile. Then, the lower it gets, then we start with other means. But I would say that number is 190.
Let's touch upon very quickly on triglycerides.
Mm-hmm. Triglycerides are, on the other hand, more related to diet and body weight and the diabetes. So things that would, the triglycerides also, the normal level should be around 150, and then this increases more in people who are overweight, in the diabetics, people who consume large quantities of alcohol, and the sweets and all the other things, good things that we love. That's more related to the triglycerides. So diet would have a greater effect on the triglycerides.
And we mentioned earlier that diabetics are twice as likely to have heart disease compared to someone who doesn't have diabetes. So why is that? Let's explain the link between diabetes and heart disease. Okay. And what are the sugar levels that are considered high, pre-diabetic versus diabetic as well?
Very good. Diabetes is a major risk factor for heart disease. And in fact, we call it vascular disease because it affects all the blood vessels in the body. And the idea simply is that when the blood sugar is high, it attaches to the red cells, so makes them more sluggish. The circulation in the small blood vessels are sluggish. And also it damages the lining of the blood vessel. So it allows the particles, the small particles of the cholesterol to find their way in there and start forming the plaque. So we say the fasting blood sugar, which is the blood sugar in the morning after about 8 to 12 hours of fasting, that should be in the range between 70 and 100, and that would be considered normal. Anything more than 100 at the fasting level, so you're a pre-diabetic, until you reach 125, 126, then over that it's considered diabetes. So this is how roughly the numbers that we should be aware of.
Now, what kind of diabetes? Can you just keep your diabetes in check and protect your heart that way, or should you do something else?
Well, keeping the diabetes in check is a major relief for the heart. If you have a vascular disease, definitely this is one of the main target of the treatment, is to control the blood sugar. So the one measure that we use for people who have diabetes, we call it the hemoglobin A1c, or glycated hemoglobin. That's the hemoglobin that has been circulating in the blood and the sugar attached itself to it. So if we measure that percentage, we can have a rough idea of how well the blood sugar has been controlled. And that number is around the 7%. So we want to keep it always less than 7% in the diabetics. And that should give them a significant protection.
Now, high blood pressure is also another risk factor for heart disease. And high blood pressure sometimes goes undetected for a while before you notice it. So let's explain as well how risky it is and how can you avoid having high blood pressure, especially if you have family history of high blood pressure.
That is also another very good question, because high blood pressure is commonly overlooked. And people, they just don't know that they have high blood pressure. The most common presentation that we see is that someone who just accidentally has been going to the dentist, for example, and just get the teeth cleaning, and then they measure the blood pressure and it's high. They think it's because they are anxious because they are in the dentist, and then another time in the primary care, and another time maybe at school, or another time in a mall. And then, but every time you get a high reading on the blood pressure, that's indicate that you need to take action. Yes, we have certain scenarios where the blood pressure can be high temporarily, but if there is a family history of high blood pressure, and you have a high blood pressure for many readings, then this is time to seek attention, because it is, like you said, silent killer. It is a major risk factor for stroke, and a major risk factor for heart disease, major risk factor for kidney disease, and also the peripheral arterial disease. So that's along with the diabetes, they go hand in hand. And they tend to happen in people also who are overweight, obese, and this is the kind of what we call it, the profile of patients who are at risk for heart problems.
This brings me to my next question, which is the link between heart disease and stroke. They're very closely linked. Let's explain that link.
Okay. If we talk about stroke, stroke is, in other words, we call it brain attack, just like a heart attack. So there are blood vessels just like these in the brain, small blood vessels, and they undergo the same change. So a blood clot can form inside one of the small blood vessels that are going to the brain, or a small blood clot can come from the heart and what we call embolize to the brain. So it's actually carried by the bloodstream. It's formed in the heart and then carried by the bloodstream in small pieces and sludge the small blood vessels of the heart, of the brain, and then cause what we call the brain attack. The same buildup of plaque that happens in the heart arteries can happen also in the carotid arteries, which are the arteries that are the main pipes that carry the blood to the brain, and this is also a major source of stroke. And the same risk factors pretty much for the heart problems are the same risk factors for the brain or the stroke, the diabetes, the high blood pressure, the high cholesterol, and the age. So they are closely related, and they tend to go hand in hand, unfortunately, but the good news is that we always have effective means to reduce the risk of both.
Let's explain the first symptoms of heart disease.
The first symptoms of heart disease It's variable. I would say the chest pain. People tend to come in presenting with the chest pain as or shortness of breath. These are the two most common symptoms that the people present with.
Now, before we discuss the symptoms in detail, let's have a look at one of the images we have, which will explain or show how the plaque builds in the arteries of the heart, doctor. Maybe you can explain to us how this works, or how the plaque builds up over time in the heart.
Sure.
But you can start explaining to us. Don't worry.
All right. So the first is that there are circulating small particles in the of the cholesterol that circulate in the blood, and then what happens is that it will find a damaged lining for that blood vessel. So, and once it starts getting in there, embed itself in the lining of the blood vessel, and then start growing, attracting what we call inflammatory cells, and building up in a kind of a mass that start gradually narrowing the lumen of the artery. And at some point, there will be risk of a cracking of that plaque. And this is the basis, basically, of the heart attack. So there will be a small crack on that plaque. The blood is flowing on the surface of that crack. They think that the body is bleeding. Because they find the rough surface, something that they are used to. So the platelets and all the clotting factors start to attach itself to that part and quickly form a blood clot that occludes the blood flow, and this is how the heart attack happens.
We have a Facebook question, doctor, about blood pressure. So will losing weight actually reduce blood pressure?
It certainly does. However, let's be realistic about it. I mean, the blood pressure is multifactorial, we call it. It's a combination of genetic and environmental factors. So weight loss will reduce the blood pressure, but I would say about 5 to 10 points. So depends on where you are. So if your blood pressure is borderline high, like 145, or we're talking around that range, then definitely an intervention like that can make a difference. But if we're coming from 170, 180, then just losing weight is not going to do it. I think medication is going to be needed, and also depends on what kind of weight we're talking about. If we're, the BMI, we're talking 40 plus is different than if BMI is like 29 or something. So it's a little bit variable. However, either way, definitely it is a desirable intervention, and if it does not get you to the level that we want. However, it will reduce the need for more medications. So let's say if you're using 2, 3, which is common for people with high blood pressure to use 3 and 4 meds. So doing that kind of intervention will reduce the need and requirements for more medications.
Going back to the symptoms of heart attack, you mentioned chest pain is one of the most common. But chest pain can also be a signal or a sign of something else. So how can you differentiate between the dangerous chest pain, which might lead to heart disease or heart attack, and something else?
Okay, so yeah, that's definitely one of the most common symptoms that we see. People think any kind of chest pain is a heart attack, which is not true. If we want to make it simple, the chest has many structures. It has a heart, and then the heart is covered by a membrane, which we call the pericardium. And then there are the lungs, which is also covered by a membrane called the pleura. And there are the ribs and the muscles in between the ribs, and then the cartilage that connect the ribs to the sternum bone. All these structures can get affected, and all of them can generate chest pain. So if we're talking the pain that should be alarming is a more of a diffuse central chest pain. I wouldn't call it pain, it's more of a pressure-like feeling, and commonly radiates to the neck, to the jaw, to the left shoulder, or both shoulder, or to the back. This should be alarming, but any pain that is, let's say, sharp and localized into one spot, something that you could put your finger on, chances are it's not the heart.
Okay.
Pain that is getting worse by deep breathing movement, like when you take a deep breath and the pain is getting worse, chances are it's not a heart-related pain. So this is kind of roughly, you know, because we get a lot of patients who get nervous by feeling a pinch here and a pinch there, and they go to Google and then they start, you know, getting the whole run of an anxiety, and then anxiety kicks in, and so on.
And heart palpitations,
and
which is yet another symptom
that
of
is true.
Heart disease. So again, it can be due to anxiety, as you just said.
Absolutely.
It can also be a sign of heart disease. So again, how can we tell the difference?
All right, for the palpitations, it's, you know, the heart start beating when we're 6 weeks in the womb, and then until the last second of our lives. So it's our brain gets used to that heart beating. So that's why we don't feel it all the time. Otherwise, we're going to go crazy. So what happens if there is any change in the rate or the regularity of the heart rhythm or the force of the heart contraction? Then our brain starts to become alerted to it, and that's what we call the palpitations. Every heart cell that we have is able to beat on its own, and sometimes they are able to generate their own electrical activity. And the most common cause of the palpitation, what we call the skipping of the heartbeat, or you feel like your heart is sinking down, and then you feel a thump or a boom, that we call it premature or an ectopic beat. It's kind of a beat that came in out of place and then kind of make a delay because the normal beat cannot find its way in there, and then it generates that kind of feeling that the heart is sinking, and you're feeling. That's very common. It's 99% benign. Nothing really that, you know, people shouldn't be worried about it. It is commonly related to the lack of sleep, excessive caffeine, excessive alcohol, and on top of all the stress.
The silent killer again.
Yeah.
Now, fainting is also another one of the symptoms of heart disease, maybe lesser known, as we mentioned in the beginning.
That's true.
So how is dizziness or vasovagal syncope linked to heart disease, and when is it just fainting as a certain trigger rather than heart disease? Okay,
that's also very common. Vagal reaction, what we call a vasovagal reaction, it's a reflex. It's basically sudden dilatation of the blood vessels in the body, and it's neurologically mediated. So it's a kind of a reflex, and result that the blood kind of pulls down to the leg away from the brain, and then people faint and pass out. It's very common. At least 50% of the people, once in their lifetime, they would experience something like that. It tends to happen with, again, lack of sleep, fatigue, decrease in the body water or dehydration, closed and warm environments. You know, it tends to happen in classroom, church, and, you know, they're just cold, you know, dark and warm environment. And also with the diabetics and, you know, from the neuropathy and all that. And it is relatively benign. It's usually, you know, well controlled by adequate hydration. The first thing that you should, if someone experiences frequent episodes of these, the first thing they should do is that they should, whenever they start feeling the prodromal symptoms, we call it, which is like, I'm gonna faint, they start to become queasy, a little nauseous, and then they will start to get sweaty and clammy. This is the time when they should immediately take a seat, and if they can, if they are in a place where they can lie down and raise their legs, I think that will break it. Otherwise, they can, if they are in a place where they cannot lay down and sleep, and they can just squat. You know, squatting can just come down, squat in squatting position. That kind of helps to increase the venous return to the brain and break that cycle. But it is very common. It is not really a heart disease per se. I don't think it should be connected to the heart. There are some very rare subtypes of these where there is the heart rate kind of slows down significantly. In that case, and this happens rarely, and you know, and that these are the cases where they need different attention than the most common, you know, people who pass out.
Now, in case someone passes out in front of you, let's demonstrate what we should do. So maybe we can get this model out.
Okay.
And I'll let you demonstrate.
All right. So let's say you know, you're in a birthday party and then someone is just collapsed in front of you. The first you walk to them. You want to walk to them. You want to make sure they are breathing. That's very important. So you would start shaking them, call their name, and they are responsive, or you can determine if they are responsive or not. And if they are not responsive, the first thing you want to do is to make sure they're still breathing. So, and the best way to determine that, you can just simply look at their chest, look at the chest rise. And also you can put your face or your cheek next to their mouth or nose and kind of try to feel the air. If that's the case and the person is breathing, the best way to, of course, immediately you call the emergency medical service, and then you turn the patient on their side. And the reason we do that is because once the patient is unconscious, then there is relaxation of the muscles of what we call the oropharynx, or the muscles in the back of the throat, and the tongue tend to fall backward and obstruct the airway. So with that, the best position to keep this patient who is breathing, that's very important that you're sure they are breathing, to put them in what we call a recovery position. So put them on their side. That will make the tongue fall forward and prevent them from choking or swallowing their tongue, so to speak. If the person is not breathing, or you're not sure if they are breathing or not, just the best thing is to start CPR. And this is a basic skill that everybody should try to pay attention to do that. I mean, there are special dedicated courses, but not everyone is able to attend that. But just knowing that basic skill, which is called CPR, you cannot imagine how much difference it can make and can save lives. So basically, you walk to you have the person on his back, and then you try working your hand on their belly until you start feeling the sternal or the chest bone. Just go 3 or 4 fingers on top of that, and then you put your thumb, and then you start, applying heart pressure. I think it's easier to, harder is better than softer, because you want to make an effective compression. And just continue to do that, and that's the best thing you can do for someone who is not breathing or have a cardiac arrest. Continue to do the CPR. If there are more than one person around, just to rotate and see if they can, so no one can get tired very quickly. You want to do 30 compression, and then you can start in giving, some breath through the mouth if possible. But the most important thing is just keep doing that CPR and chest compression, rotate and make sure they're effective compression, and you go down and deep and make sure to massage that heart and get the circulation going. And this is the most effective way and the best thing that can make a difference in people's lives.
Is it 30 compressions per minute?
30
roughly?
compression, yeah, 30, and then you give the breath if you have to do the breath. But it's actually, you should continue. So 30 compression, 2 breath, 30 compression, 2 breath. Okay. And so on. And the compression should be fast. And as I said, try to make it effective. It's not like, so make sure
there
it
should
is.
be pressure exerted.
Yeah, it should be pressure exerted, and you should allow the chest to recoil. So, so if I would do one like that, one like that.
Yes.
Okay. So that's a very important skill and simple one. People should, know it, because nowadays they can, whether you're in a gym or you're in a mall or you're at the beach, you might run into that, or on a plane, you might run into that, and it literally saves lives.
Sometimes, doctor, if someone actually collapses in front of you and you see there's no pulse and no breathing, sometimes they say if you just punch it in the middle, it might actually start the heart again. How much does this actually work?
Well, it doesn't work that much. We call it a precordial thump, and it is known. The idea is that you deliver a shock to the heart. So you reset the electrical activity of the heart. It's kind of should help if you don't have a defibrillator. I mean, it doesn't work all the time. I think I would,
go for CPR.
I don't want to see people banging on someone's head. I would just stick with the CPR.
Okay.
I think this is a safer approach and most, like a most reliable way. The precordial thumb, the chance of it working is kind of, very questionable.
Okay.
Okay.
Before we end, let's leave our viewers with some advice.
Okay.
As we start the new year, how can they take better care of their health and their hearts?
Well, in short, I would say eat well, sleep well, know your numbers, and exercise. I don't know, I'll leave it
Quite
at
simple.
that. Quite simple.
Even though it's easier said than done, though.
Yes, but...
We all have New Year's resolutions at the beginning of the year, but sticking to them is another matter.
You're right. But this is always should be the priority. Just so people should, eat well, have some concentrate a little bit on more fruits and vegetables, less of the, hydrocarbons and all that, and sleep well, 7 or 8 hours, and know your numbers, blood pressure, blood sugar, cholesterol, and exercise. We talk about, I would say 30 minutes 5 times a week, or a total of 150 minutes a week. That should be good enough. And you monitor your heart rate and during the exercise. And I think that will make a great deal of difference.
Dr. Salem, thank you so much for coming on the show and showing us how to perform CPR in case of an emergency, and for the valuable input you gave us tonight.
Thank you very much, Maya, and I'm glad to be here and wish all the viewers Happy New Year and a healthy year.
I wish them the same, and as we kick off 2021, I would say maybe focus on getting to a healthier version of yourself, whatever that may be, gradually, instead of setting ultimatums that might work temporarily but ultimately end in failure. Join us next Tuesday at 8:30 p.m. Dubai time for a very special episode of Wellness Matters with Ahmed Yahya, who is the Chief of Technology and Innovation at the American Hospital in Dubai, and Dr. Mazen Zuwayhid, who is the head of the ICU department here at the American Hospital as well, as we discuss the latest developments surrounding artificial intelligence, the first in the region, conducted by the American Hospital in collaboration with Cerner. So make sure to be with us next Tuesday at 8:30 p.m. And don't forget to like and share this episode on Facebook, to subscribe to the American Hospital's YouTube channel, and to follow their page on Instagram. And have a good night.